All right, we have a lot to unpack today, so I'm going to try to make this as quick as possible. This is John Baston here, the President and Chief Growth Officer of the Midstate Group. And as many of you know, we are all about compliance. We have safety compliance teams, we have HR compliance teams, we have cyber compliance teams. And really our whole goal is to make sure that you, our customer base, is aware of the many requirements or mandates that are put up against you possibly, or for you, depending on how you're looking at it. But this is coming from the government. Yes, they're knocking on your door and they're saying that they're here to help. So as of Friday of this past week, they have put into effect, they being the Virginia Department of Labor and Industry, has put a new law into effect that took effect again as of this past Friday. And so we'll go over this just a little bit just to make sure you're aware of it. Now, what I do want to make sure is that you don't confuse this with the federal emergency temporary standards. So in Virginia, we were the first to have a COVID emergency temporary standard for safety that went into effect July of 2020. Now that became permanent as of January 2021. So again, Virginia was the very first state in the nation to actually have an ETS, but you will remember that Biden just came out about a month ago or less that stated that he wanted to put a ETS into effect. Now, the Virginia law that we're talking about today is totally different from the federal mandate that is being proposed and is not into effect. So if you are looking at being 100 employees or greater and having no vaccinated employees or not having your whole employee base vaccinated, this does not take that into consideration. There is no mandate in the Virginia law when it comes to vaccination. So let's make sure that we separate that. Ronnie Smith, she's our executive employment advisor here at Midstate HR. She did a live broadcast on WLNI with Todd Gleason, who is an employment attorney with Gentry Locke. And if you missed that live interview regarding this very subject of what's kind of covered in the new law and what's not, definitely go to our Facebook page or our LinkedIn page, and you'll find a sampling of that live broadcast. But for more information, we're going to dive a little bit deeper into it here today. So again, I'm going to try to take this and be as short as possible, but there is a lot in the 58 pages that Virginia has put out. We've kind of condensed it into 2 here today. And just be aware that we are available for you. If you need more information, if you have specific questions, not only does Virginia Department of Labor and Industry have an FAQ on their website, but we'll be more than happy to answer any questions that you have. Just reach out to us at info@midstatesafety.com. Or feel free to call us at 434-528-1001. So as you can see with this new Virginia law, there are some hefty fines, and what we want to make sure of, again, is that you are aware enough of what your responsibilities are so you as a small business or a medium-sized business can avoid this. Now, what you'll notice is that the purpose of this law is in, again, Virginia. It's not federal. So if you are a establishment or a business establishment in the state of Virginia, this applies to you. So it shall apply to every employer, every employee and place of employment in the Commonwealth of Virginia. So whether or not you have 100 employees or 3 employees, this is for you, or if you've got 100,000 employees. So every employer shall put this in place. Now, it does say regardless of risk level. So in the January 2020 law or January 2021 law, it really had these various tiers of risk, low, medium, and high risk. Well, they've kind of done away with that right now. And really, there's only kind of 2 types of businesses. You're either high risk or you're not. Now, you are automatically high risk if you have mixed vaccinated workplaces. So if you've got 11 or more employees that are not vaccinated, you're considered high risk. If you are in the transportation business, if you are in the healthcare business, if you are a school or manufacturing, then you're automatically seen as a high risk business. And really what that really means for you is if you are considered high risk, you just have to have a infectious disease plan in place. Most of you, again, already have that in place based on the January 2021 law. And so don't stress out. A couple key points we want to bring to your attention, though, is that, again, many of you, small and medium-sized employers, are already doing what you need to do. And so if you're following the January 2021 law, you're probably 90 to 95% already in compliance. The key thing that Virginia puts into this new law over and over again is that if you're following CDC guidelines, if you are in good faith, trying to do everything that they're saying that you should do, whether mandatory or non-mandatory, OSHA or Virginia OSHA is going to consider that in compliance. They're going to see that you're going to be, you're taking a good faith effort to try to be in compliance, and they're going to then dub you compliant. So just keep that in mind. There is no requirement. Again, we want to separate what Biden is doing on the executive order for the ETS, or emergency temporary standard there federally, versus what we're doing here on the permanent COVID standard in the state of Virginia that now is just being updated as of October 8th. And what that means is you do not have to vaccinate your employees. You do not have to force your employees to get vaccinated in order to be in compliance. There is no mandate regarding vaccinations when it comes to the Virginia law. There is no requirement for contact tracing. So if someone gets COVID, you do not have to conduct an interview and perform contact tracing. So just something to remember. Now, one thing that you will have to do as part of this new law is that any test that the employee takes to confirm COVID or not, then that has to be paid for 100% by the employer. We'll talk a little bit about that here in a second, but 2 dates to remember. October 8th is when it went into effect. Now, there is one portion of this law that doesn't take effect until November 7th, and that is the training requirements. So if you have not performed any training thus far, then you will need to do so by November 7th. Now, for many of you who have already done extensive training for your employees, most likely the training that you've already done is adequate enough for the October 8th mandate. So don't stress out. You don't really have to do more, but if you've already done extensive training, you're most likely already in compliance already. So and we'd be more than happy to review that with you just to let you know for sure. So a couple things that no matter if you're looking at the federal law that's not quite in place or the Virginia law, they're all really saying the same thing. One of the key aspects of this is that the foundational policies and procedures must be put in place. If you do not have a written plan, you are not in compliance with this new update. You should already have policies and procedures already when it comes to safety. And so all you really have to do is add the COVID-19 procedures to that in order to be compliant. Now, one thing that the Virginia state law is saying is that just because we have this new updated version of the permanent standard doesn't mean that we don't already have a lot of programs or standards in place when it comes to OSHA, whether it's your personal protective equipment laws that are already in place, whether it's the respiratory laws that are in place, HAZCOM. OSHA over and over again, or Virginia OSHA, points to all of the other federal laws that are already in place, and that this new update does not take away or rescind any of those existing laws. It also states that, hey, you have to be cognizant of the Americans with Disabilities Act with EEOC, the Equal Employment Opportunity, or really Title VII is really what it's looking at. And don't forget, you can't violate FMLA, workers' comp, or ERISA laws that are already out. So it's kind of a way for the government to CYA. They're basically saying, yes, there's a new law, but there's all of these other laws, the alphabet soup that you already are having to be in compliant with, and don't forget about those. The next really big step that OSHA has really been pushing for years, and again, this is part of Virginia OSHA mandate, is once you have that policy and procedure in place, you should be conducting a risk assessment. Not only are you doing your normal mock OSHA inspections, but you really should be looking at your facility versus specific jobs that your employees are having to perform, and how does that relate to this COVID risk? What are the hazards that they're confronted with, and what are the unique issues that you're going to find in your facility or job? Now, one of the things that this new update is requiring is that you not only look at the risk assessment of the facility and job, but really looking at the differences between who are vaccinated in your employment and those who are unvaccinated. So this is a little bit different. Now, we're not mandating the vaccinated employees, but now they're saying is that you as an employer need to do a survey and find out who is vaccinated and who is not. And based on that data, you now need to put certain policies and procedures in place in order to be compliant with this law. Now, what we're advocating here at Midstate Safety is that if you do not feel comfortable asking your employees of whether or not they're vaccinated or not, you're basically going to have to put policies and procedures in that basically assumes that no one's vaccinated. And you're going to have to follow the more extreme policies and procedures and expectations or requirements of Virginia OSHA in order to be compliant if you do not want to ask. And that sometimes is the easier way to go. So once you've done your risk assessment, then really this whole idea of monitoring and reporting. Now, most of you, again, are doing this correctly already. If you're following the CDC guidelines when it comes to who is suspected of having COVID or who is being confirmed, what you then have to do is either quarantine or isolate them based on them being suspected or confirmed. Now, one of the big changes is if you are a landlord, if you have other tenants within your building, is now the building owner's responsibility to notify the tenants of any suspected or confirmed COVID cases for employees. And so that's one of the other things that you will have to do is notify those other tenants of exposure. It is now a responsibility of that landlord to make sure that those common areas are well sanitized and cleaned. Also, if you are a business that has a lot of subcontractors coming into your place of business, you now have a responsibility, just like you did under all of the other OSHA laws, is to make sure that all of your subcontractors are properly trained, they know of your policy, you know of their policy, and more importantly, you're really advocating and enforcing the fact that anyone who is suspected or confirmed, that they stay away from your premises. Those employees cannot come on to your facility and infect your employees. And so the government is really coming down hard on subcontractors, especially you as the building owner, to prevent these subcontractors or really any other firm coming into your place to make sure that you're not allowing people to come into your place of business who may be infected. So you need to have some kind of policy or procedure that screens them as they come in. Other thing is just, hey, there is some reporting requirements coming out. If you have a death or illness within 24 hours, if there is a death from that illness, I should say, within 24 hours, you need to make sure that you report that death to OSHA, but also to the health department here in Virginia. Now, luckily, Virginia OSHA does have a easy link on their website in order to report to both departments or to both entities pretty seamlessly. The other thing is, if you have 2 or more employees that are tested positive within 14 days, Virginia OSHA wants you to report that to the Virginia Department of Labor and Industry and also to the health department. Again, one place, one login, one submission will go to both departments, and you'll see a link here on your screen. There is a provision on medical records, just making sure that your employees have access to any medical records you have of them in regards to the SARS to the SARS virus or COVID-19. Not a big deal there. The other thing, 9 and 10 here on our screen, return to work and sanitation and disinfecting. Again, if you're following the CDC guidelines, the CDC has specific information out regarding what the return to work requirements are, what the sanitation and disinfecting requirements are. If you're following those, you're already in compliant. No big thing there. Big thing though is if you have 11 or more employees in a mixed vaccinated environment, meaning that, hey, if you've got 11 or more employees that are not vaccinated, then really you're going to need to have an infectious disease plan. If you're in the medical community, you're going to need to have an infectious disease program. If you're in a high risk area period or business, you're going to have an infectious disease plan. And again, that is a separate written document that can go along with your written safety program. But now you've got to have what's going to happen if you have an infection scenario breakout at your facility. The key thing here too, as of November 7th, you're supposed to train all of your employees regarding COVID-19, but just be aware that if you're a small business, really Virginia OSHA has a one-page front and back document that you can just hand your employees and show them what they need to know in order to be properly trained. As a part of that, there is an anti-discrimination provision, and really there's a whole anti-whistleblowing provision. The way that OSHA, whether it's Virginia or federal, is getting access to facilities is other employees calling in and saying to OSHA that it's an unsafe workplace. So employee complaints is a #1 drive of OSHA, whether Virginia or federal, coming in. And so we want to make sure that you're properly training your employees, you have your written program in place, you're doing your risk assessment so that if OSHA does come in, you're going to be taking they're going to be showing them that you have a good faith effort by following the CDC guidelines and that you are in compliance. Again, just beware that if you do nothing and an employee does complain about a lack of protocol or a lack of training and policies, it is an initial fine of about $13,600, and we are already seeing fines being put in place by certain employers. Now, if you do have a subsequent infraction by OSHA, or Virginia OSHA that is that the subsequent fines will be considered willful. Now that is 10 times or up to $136,000 in fines. We have been successful here lately in getting some of these fines reduced. But once it goes to willful, you're not going to have much luck at all in getting OSHA to specifically reduce these. Actually, there was an article out today that specifically has OSHA saying that one of the things that they will resort to is shaming people, putting your name of your business and the fine in the local paper to try to prevent other businesses from doing the same thing. So they are trying to get aggressive. They're being nasty about it, and they are almost blackmailing or threatening businesses with humiliation or shaming them for non-compliance. So the best thing to do is follow the guidelines. They're very easy to do in most instances. And if you're not sure if you're in compliance, just reach out to our team. There's no charge. We'll give you a quick assessment to see whether or not you're compliant or not, and be happy to help in any way we can. You can reach us at 434-528-1001 or via email at info@themidstategroup.com. Again, I'm John Baston, President and CEO. And if you need any help, I'm always here. Thank you and good day.